I'm Dr. Brian Zelickson. I'm a board-certified dermatologist, and I'm the founder and medical director of Zel Skin and Laser Specialists. I was always interested in science, fascinated with biology, and when I went to college, I was thinking about going into medical research. And the back of my mind, I was thinking about going into medical school. When I got into medical school, I was thinking of a lot of different specialties. Looking at neurology was interesting to me, and then I did a rotation in plastic surgery, and I kind of enjoyed that. And I did a fellowship, a short fellowship while I was in medical school with a plastic surgeon and a dermatologist in Edinburgh, Scotland. And the dermatologist that was there had trained with my father, so I was able to spend some time with him. And during that period, I really enjoyed the dermatology part. I think for me, dermatology fit my personality a little bit. It's a very visual specialty. So it's something that, oftentimes once you walk in the room, you kind of see what's going on very quickly. It's a specialty where we can do, medical treatments, we can do surgical treatments, we can do cosmetic treatments. I mean, there's a lot of different aspects to it. My practice, I've been doing about 50% of it is medical dermatology and 50% is more cosmetic laser treatments, although some of those are medically indicated as well. And so the beauty is we treat a lot of port wine stain birthmarks, so I see infants and doing those treatments. And then we do a lot of skin cancer therapies. So I see people in their 80s, 90s, and even 100s. It's kind of quite a diverse practice, and I like that aspect of it. I've been in it long enough that we see kids have grown up and had families, and we're taking care of their families' kids. So it's kind of a family practice as well. We've also done a lot of clinical research within the practice, and I think that gets us to invest in the future of the specialty. We've helped develop some technologies and some techniques that are now used. Keeps us mentally engaged with moving the specialty forward. And we do a lot of teaching as well. We have the residents from Mayo and from the University of Minnesota come here, and we teach them. When you come in, from the person that greets you at the front door to all the people that we work with, the nurses and the back office and front office, I mean, we've got a great team, and I think we've all worked hard to kind of build that team, and that's what I think allows us to do the kind of work that we're doing. The philosophy that we have here that I think I try to instill when we developed it, and my father too, was that we really want to be our patient's advocate. I mean, that's kind of our goal. And so we need to understand what the concerns are and work with them to help solve the problems that they may have. I grew up in Minneapolis and Golden Valley, and I went away to school and came back, and I really love the area. Minneapolis and St. Paul and Minnesota, there's a lot to do. People are very active, a lot to do outside throughout the whole season. I really enjoy the seasons. I've lived and traveled and been to a lot of different places, and I really can't see living anywhere else. Now that my kids are gone, I've got some more time to do other things. I ride my bike, I go cross-country skiing, water skiing, play a little bit of tennis, and read other things that aren't medical.